Hi, my name is Bridget Figueroa, and today I'm going to ask you if you know anyone who suffers from diabetes, and how much do you actually know about it? You may think diabetes has two types, type 1 and type 2, or that it has something to do with your blood sugar levels, and you're correct to both. But today, I will be informing you about what diabetes is, the health effects that are associated with it, and some medication and treatments that can make living with diabetes a bit easier. Today I'm going to begin with a simple overview about diabetes. As stated by Teresa O'Dell and Stephanie Watson in their 2021 article, Diabetes Disease Overview, it stated that diabetes is a chronic disease where your body doesn't know how to turn the food you just ate into energy, which can be very crucial in a day-to-day life. Diabetes can be caused by many factors. The most common one is genetics. So if it has ran in your family, you're at a higher risk to become a diabetic. But it can also be something like an inactive lifestyle that can lead you to this. Some of the symptoms include blurred vision, an increase in appetite, feeling always like you're thirsty and not enough water is being taken in, and an unexplained weight loss. Today, I'm going to be continuing this by telling you the difference between type 1 diabetes and type 2. The difference between type 1 and type 2 is that type 1 is usually detected and developed in childhood, while type 2 comes way later on and is detected in adults over 45 years old. Type 1 is an autoimmune condition in which your immune system basically attacks the beta cells in your livers, which leads to a shortage of insulin and glucose in the body. Now, type 2, the body cells become resistant to the insulin, which results in an improper balance in your body. No matter how much insulin you're creating or how little you're creating, it doesn't matter because you're just resisting to it. And this was written in the article Diabetes Disease Overview by Teresa O'Dell and Stephanie Watson. Thankfully, there is some medication and treatment that can help you live with diabetes. It won't cure it because there's no cure for diabetes, but it can make your day-to-day life a little more manageable. A common form of medication is insulin, and depending on the severity of your diabetes, you can take a shot, not like a shot, like a shot, 1 to 3 times a day. And this will help you absorb the insulin and help your body feel a little better. This was stated by Paul Zimmet in 2001 article, Diabetes, a Global Epidemic. Now, it is very important that you tell your doctor exactly what you're feeling, simply because an altercation in medication can really affect your life. What I mean by that is that individuals with type 2 diabetes take metformin, which is a pill that helps you reduce the liver glucose production. And patients with diabetes can also be given sulfonylureas, which increases glucose in the pancreas. So if you're not transparent about your symptoms and everything you're feeling, if you have too much increase, you can die. Or if you have too much decrease because of a medication, you can die, which is very crucial to be sure that you explain everything to your doctor. Okay, now let's talk about some of the health effects that come with diabetes. Periodontal disease is a disease where you can lose your teeth. So tooth loss and periodontal disease is 50% higher in diabetics. You're at a much higher risk than an individual who doesn't have diabetes. According to Risako Mikamami, who wrote Association of Type 2 Diabetes with Periodontists in 2022, he stated that. Now, diabetes can also lead to edema, which affects blood circulation, which means you might be swollen in any part of your body. But the most common place where it's swollen is the feet. And that becomes an issue if you're standing in a long period of time, or if you're simply doing groceries or any everyday task. So it's often recommended that diabetics with swollen feet use diabetic stocks. It helps compress the circulation and helps move everything around. Now, diabetic peripheral neuropathy is when you're walking and suddenly you feel like everything's falling. It may cause you to lose your balance and a sensation that the room is coming into you. Now, let me tell you a couple of things that can help you live with diabetes, but you can change some little habits every here and there to make life a little easier. Simple things such as a simple walk in the morning or a jog in the afternoon can be very crucial to lowering or balancing your glucose levels. You should always avoid refined carbohydrates. You should keep those levels low, such as pasta, rice, cake, ice cream, cookies. Anything that has too much sweet can really throw off your levels for that day. It's often advised that people have a very strict diet and try to have a healthy lifestyle. Simply exercising every day and eating your veggies can really make a difference. Thank you.